Well, hello everyone. Welcome to our special edition of a Facebook Live for Breast Cancer Awareness Month. My name is Lauren Letillier. I'm the Director of Communications and Community Engagement here at HCA Florida, North Florida Hospital. And we are so excited to have a very special guest join us today to talk about the link between breast cancer and genetics for Breast Cancer Awareness Month. We have our genetic nurse practitioner, Danielle Rogers, here. She is here at the hospital. Takes patients here, and we're so excited to have her today to talk about this absolutely fascinating subject. Thank you so much for joining us today.
I'm so happy to be here. Thank you for having me.
Yes, absolutely. So before we get started, Danielle, I wanted to do a little bit of we go through like a list with our viewers. So just wanted to make sure we sound good today. So let us know in the comments how we're doing there. And then also, if you guys are tuning in today, tell us where you're watching from. Say hi to us. We would love to see who's watching today and possibly see if we can say hi back. Also, if you have any questions for Danielle today about genetics and breast cancer, go ahead and submit those in the comments at any time throughout the broadcast. Don't feel like you have to hold on to them until the very end. You can go ahead and submit them at any time, and I will be keeping track of them here on my phone so we can get those questions answered live here during our Facebook Live segment. All right, Danielle, are you ready?
Yes, I am.
Fantastic. Danielle, tell us a little bit more about yourself so that the audience can get to know you better today.
Sure. So my background is in oncology, which is cancer care. I'm an advanced oncology nurse practitioner. I'm also certified in genetics. I think the biggest part of why I do what I do is, I love patient care. I love teaching and educating patients about not only a disease process, but very passionate about the prevention and risk reduction portion of it. Because I always tell patients, when I'm doing genetic counseling or genetic testing on a patient, I'm obviously concerned about that individual's overall risk. But when we do identify a hereditary component, I have that patient, but then I inherit a family, because again, the importance is also in the people that matter to them most. So trying to help extend that education and information to help prevent cancers and reduce risk in individuals and families.
That's fantastic. Yeah. I know you're so passionate about this, and that's what makes you so good at what you do. And we're just so thrilled that you're here because you're new here, relatively new,
yes.
Correct?
Yes, right at a year.
Oh my gosh! Congratulations!
Yes,
that's fantastic.
Thank you.
Well, this is a wonderful kind of new service that we're offering our patients, and that is so highly desired. So we're so thankful you're here, Danielle.
Yes.
So before we get started, if you could actually move that red laptop more this way. That would be perfect because we are seeing it on screen. I'm so sorry about that. All right, now we're ready. I'm a perfectionist, everybody. All right, so Danielle, tell me a little bit about what is the link between genetics and breast cancer?
Sure. So what I always like to tell people and patients is, cancer itself is a genetic disease. And what I mean by that is for cancer to occur, there has to be changes at that molecular or what we call that cellular level in our DNA. And so what that does is, in our lifetime, we're consistently exposed to environmental factors or influences, hormones, viruses, stress, lifestyle factors that can cause genetic changes in our body. And over time, that can actually lead to what we kind of coin as genomic instability in the cell. And we know cancer is the uncontrolled growth and division of cells. When we talk about genetics, in the context of hereditary cancer testing, is we're trying to see, are there inherited changes from genes that you inherited from your mother and your father that could predispose you or increase your risk for cancer. Of course, there is another side to genetics we call genomics, which is when we are trying to know, what is the genetic makeup of this tumor and can we target with certain therapies. But looking for heritable changes does not mean that someone actively has cancer or that they're going to develop. It just indicates that they may be at a higher risk.
Absolutely fascinating to me. I have cattle, and so genetics has been a huge part of my background. So I think anything having to do with genetics is fascinating. So tell me a little bit more about when might a person consider genetic testing for hereditary cancer syndromes, because this really isn't for everyone, right? Everyone is kind of nowadays we're like, oh, let's go and take the test and see if we're going to get cancer. That's kind of not for everybody.
Yeah, not right now.
Not recommended.
Right. Not right now. I'm not saying it's not coming.
Okay.
But, within the context of breast cancer, we we kind of figure about 5 to 10% of breast cancers are related to heritable changes. So just to inform everyone, the majority of breast cancers we do diagnose and treat are not familial, they're actually sporadic, which means they happen by chance and because we're human. But when someone might pursue testing, a lot of it depends mainly on their personal history. So someone who may have a personal history of breast cancer or other cancers that could be related to a hereditary breast cancer syndrome, or someone who just may have a significant family history. That means they do not personally have to be diagnosed, but because of their family history, there may be enough risk related to that to justify testing. And there are things that we're looking at. We're looking for certain red flags or triggers. Some of those are, seeing someone diagnosed with breast cancer at younger ages than we would expect to see, say, in like the general population. Rare types of breast cancers, like a type of triple negative breast cancer, male breast cancer, those are all not the more commonly occurring, but we can see them associated with several of the hereditary breast cancer syndromes. One study from MD Anderson did find that 18% of women with breast cancer were found to carry a mutation regardless of their family history. So there's been a lot of shift and change in, how to even approach patients actively with cancer, pursuing who's appropriate for testing and who's not. So we may see more of a shift in that maybe all cancer patients may eventually proceed with genetic testing at some point in the future, but there may be an opportunity as we iron out a lot of those wrinkles for us to do population-based testing in the future.
How interesting is that? So how can genetic testing really help someone with that family history? That's
Absolutely.
Really what we're looking at.
So as humans, we always quote average risk. We'll tell someone, hey, you have a risk for breast cancer. If you're female, it's roughly about 10 to 12%. Same thing for colon cancer in men and women, and so on. The thing is patients with heritable risk appear to be higher than the general population. So being able to do genetic testing can help us better quantify that risk. It can really give us a little bit more of a finite understanding as what that person's risk is compared to the general population. Now, with that information, it can change how we surveillance that individual, whether we start at younger ages, because currently there's kind of standard guidelines, so mammograms are recommended to begin at age 40 in average risk women. Women with a genetic predisposition may need to start as early as 25, 30, or 35.
Wow.
And oftentimes it's not just obtaining a mammogram, it may require other enhanced surveillance. There may be even opportunity for preventative surgeries in some cases. And two, it helps us to not only implement the earlier surveillance, but if something were to happen, it would give us a higher opportunity of finding something earlier rather than at a later stage as well.
And that early detection is really what saves lives.
It's always key.
I mean, so key. Are there any other cancers that you can see with hereditary breast cancer syndromes?
Absolutely. So one of the more common hereditary breast cancer syndrome is what we call hereditary breast and ovarian cancer syndrome. And that is a result of mutations in the genes BRCA1 and BRCA2. These are genes, yes, we all carry. Many people do not understand that these genes are naturally designed to protect us. They actually act as tumor suppressor genes, so they repair damages in our DNA.
Wow.
What we found is in families and individuals who inherit mutations in these genes are at a higher risk for certain cancers, primarily female breast cancer. We can also see ovarian, we can see pancreatic, melanoma, and in men we can see prostate cancer and male breast cancer as well.
That's fascinating to me. Another question that comes up a lot, like, what if I'm adopted and I don't know my family history? I mean, what would you recommend to a patient like that?
So I get that question a lot.
Yeah.
Especially when I'm counseling a patient who may have been newly diagnosed, even if they're 78 and they've gotten their first breast cancer or first colon cancer, if they indicate that they're adopted, you kind of have this big unknown. You don't know, did they have an extensive family history? And the thing is these individuals, of course, may have children that matter to them. Again, it's about the family risk. So I will absolutely, test those individuals or give them opportunity. For patients who come in and are adopted but don't have a personal history, sometimes it is harder to get coverage for testing. However, the cost of genetic testing has decreased substantially. So there is opportunity for cash prices that can be affordable for patients that want to pursue that.
Sure.
It's not something we readily recommend, and I would not recommend someone do it without getting extensive genetic pretest counseling, because I really think patients need to understand, even if you're adopted, it's still only 5 to 10% of cases that are hereditary, and you need to be prepared for the potential outcome. You don't want to do it on a whim.
Absolutely. What are the potential risks of genetic testing?
Sure.
That you can talk
So,
about?
I think obviously the anxiety, the fear, of developing a cancer. It does create a little bit of an impact financially when you're talking about having to see many specialists. I mean, healthcare costs, are still a problem in this country. The other thing is, repeated testing. That always happens. I mean, the more screening you have, that more potential out of pocket. And of course, you always worry about, the risk of false positive or false negatives.
Mm-hmm.
Again, I will say with more reputable laboratories, you don't really encounter that.
Okay.
But one of the things I do, talk to patients about too is that even in light of negative genetic testing, it doesn't mean you can't ever develop cancer, and it doesn't 100% mean there's not a mutation. So patients who are undergoing genetic testing today that are either negative or have what we call uninformative results, meaning we really don't have much information to explain the family or personal history, may be appropriate for update testing in the future, because genetics it's always evolving, it's always changing. Mm-hmm. Another thing that I encounter a lot too is that guilt. There is survivor guilt. I've had families where there was a known mutation and then I test a family member, they're negative, and they almost feel guilty that they're negative. Mm-hmm. Or a parent may be guilty about potentially passing a cancer risk, mutation to a child. So there really is a lot of psychosocial distress screening that you have to do when you are counseling these patients, because you want to prepare them, but you also want to make them feel supported and encouraged, and try to maybe use cognitive behavior therapy to help them, kind of cope with this information.
Yeah, absolutely. So you've touched on this a little bit before, but does insurance cover that genetic testing?
Absolutely. Most insurances are going to cover genetic testing. That goes for Medicare, Medicaid, federal, and commercial insurances. Mm-hmm. I know early on the cost of genetic testing was quite expensive. The criteria was stricter, but as we're kind of moving along, I mean, I would say 99% of patients do not pay for their genetic testing. It's typically covered in its entirety. Even the out-of-pocket cost in regards to copays tend to be very affordable, and these genetic laboratories do have very transparent billing policies which are protective of the patient. It's like the patients are communicated about their out-of-pocket, they have the choice to proceed or decline testing, and they also have great patient assistance for even uninsured or underinsured patients.
Wow, that's fantastic.
Yeah.
Before we move on with our program, and we have a few more questions to ask Danielle before we get to your questions today, I just want to remind you, please submit your questions in the comments of our live feed. I don't see any yet, but I do see some people tuning in, so I'm loving our viewership today. This is fantastic. Thank you guys so much for watching. But if you have any questions for Danielle, you will have a chance to ask those questions here live on Facebook. So go ahead and type those in the comments section of the live feed, and I'll be watching for your questions here really shortly. Okay, Danielle, tell me a little bit more about we talked about insurance. So how is genetic testing done, and where can you go and get that genetic testing?
Sure. So genetic testing for hereditary cancer syndromes is oftentimes, it just involves as simple as a blood draw, so like a venipuncture or a saliva sample. I will say that blood specimens do provide a little bit more quality DNA. For the times that I've actually had specimens rejected, it usually was a saliva sample because there are specific instructions. The other thing is saliva may limit our ability to do certain types of testing as far as our combined RNA analysis when we are doing that. As far as getting where to get the genetic testing, of course, patients can come see someone like me, a genetic counselor. There are providers who offer hereditary cancer genetic testing in their office. So I encourage patients, if you have a family history that's concerning or concerning to you, please feel free to bring that up with your physician, your provider. Those that do that in their office may be able to offer you that opportunity. If they don't, they can refer you out to someone who can talk to you about that. A lot of these genetic laboratories do even offer telecounseling. So when you're talking about rural America, patients that may not have the ability to come locally to talk to someone in regards to testing, there are opportunities there. Because, the thing is trying to make the testing opportunity available to all patients regardless of where they live, their economic status, and things like that. And of course, there are direct-to-consumer testing available, but I do tell patients, do take some caution. It's a little bit different when we're testing through a CLIA-certified lab, especially like a clinical laboratory like we use in the healthcare setting. But, all in all, if there ever is a inconclusive or, questionable testing through a direct-to-consumer, you can always reflex and test through a more legitimate laboratory if needed.
Fantastic. Awesome. Danielle, thank you so much. We really appreciate this information today. We are having questions coming in, so
Okay.
I want to have time
Sure.
to answer those here live on our Facebook Live special edition for Breast Cancer Awareness Month. Thank you all for tuning in. We have Danielle Rogers here. She is a genetics nurse practitioner here at HCA Florida North Florida Hospital, and she's going to be taking your questions today on breast cancer and genetics. So if you have any questions, go ahead and put those in the comments of our live feed, and we'll go ahead and answer them live here on our Facebook page right now. Okay, so I see some questions popping up here, so we're going to see if, all right, perfect. So Kira has a question for you,
Sure.
Danielle. She says, Danielle, how much would genetic testing cost out of pocket if they don't have insurance?
So, in all honesty, an uninsured patient, like I said, these laboratories have a lot of patient assistance programs. I will say there's been times it has been easier to get coverage for an uninsured than an insured patient at times. But if someone were just wanting to pay with the cash price, typically the cost of these testings now are right at about $249.
Interesting.
And these include panel testing, so these are multiple genes, associated with hereditary cancers. So I'm
Okay.
looking across 9 to 11 different cancer risks.
So it's extremely comprehensive.
Yes.
That's fantastic.
Yes.
Awesome. Thank
Thank
you
you.
so much for your question, Kira. That's awesome. Thank you, Danielle. All right, so Kelly actually has a question for you, Danielle.
Mhm.
She says, hi, Danielle and Lauren. Love you all and the knowledge that you share with your patients. Hi, Kelly. Thanks for watching again today. Kelly watches us a lot.
Okay.
She's a great viewer. All right, so Kelly's question is, what if genetic testing comes back negative
Right.
for hereditary history,
Mhm.
and the person gets diagnosed with breast cancer or any cancer?
Right.
Do we account it for environmental factors? What would you say?
That's a great question, Kelly. I always like to say, even in the presence of a mutation, cancer is always multifactorial. It's never just one thing that causes it. And I do tell patients, even patients who undergo genetic testing because of their family history and are negative, meaning based on our knowledge and technology today, we did not identify something. I always tell them it does not mean they cannot ever get cancer. However, when I do have those patients in my office, and I'm sure when they're counseled, at other facilities or other places, we do still consider family history even when someone's negative. So I would say about 35 to 40% of unaffected women, so these are women who have not been diagnosed with breast cancer, that undergo genetic testing because of their family history of breast cancer will still qualify for enhanced surveillance. So there is still opportunity, even in a negative genetic test, for a patient to undergo more enhanced surveillance or possibly even earlier surveillance. So again, it's very important to communicate that family history and ages at diagnosis if you want. Because, obviously a woman who's diagnosed with breast cancer at 35, you're not necessarily going to make her daughter wait until 40 to start her breast screening,
Sure.
And again, these women may also need additional enhanced surveillance apart from just a mammogram once a year.
Absolutely. Well, awesome, fantastic question. Thank you so much, Kelly. We really appreciate you watching today. Also, we have another question from Jessica.
Okay.
Jessica says, Danielle, can someone call and make an appointment to get genetic testing, or do you need a physician referral?
So we, in an office setting, oftentimes patients can call and set up an appointment. With a physician referral, it's helpful as well because it does give us like that primary care provider that we can communicate information and results to. However, I have had patients who have called and set up an appointment, and if they are not established with a primary or specialist for enhanced surveillance, we do try to help get them navigated to the appropriate providers for their care and surveillance.
That's fantastic. Awesome. Thank you for your question, Jessica. We appreciate you tuning in today. All right, so I have a couple more questions. We're going to take a couple more questions before we wrap up today. So thank you guys so much for watching and for being so engaged and for submitting your questions to us. It's so helpful because these are the questions that everyone has. And we thank you for your courage in asking these questions in our Facebook Live because it helps everybody. So thank you guys for helping us make this program valuable to our community. So Danielle, how long does testing results normally take to come back?
So typically about 2 to 3 weeks.
Oh, okay.
It's really got a very quick turnaround. I think we have, our advanced technology to think to that, being able to sequence multiple genes with one specimen. So typically the results are back within 2 to 3 weeks. Oftentimes these genetic laboratories do offer a patient portal. So the patients can actually track the status of their testing,
wow.
when their specimen is received, when it's processing, their insurance information, as well as when their test report is available. Of course, the provider has to review and release the report. But if they don't, within so many days, they will automatically release to the patient.
Okay.
But yes, absolutely. It's a very quick turnaround, I believe.
Fantastic. That's awesome news. We all love that.
Yes.
Instant gratification here in this day and age. So what are some, I'd love to wrap, this is a great question that's been submitted, and I would love to wrap it up with this. What is your advice to a patient who has tested positive and after going through all this genetic testing? What is your advice to them?
So I always start the conversation because, you know, I am counseling some patients who are actively diagnosed with cancer, so they're already dealing with the trauma of a cancer diagnosis. And then to go in and tell them that they may have additional risk for other cancers can just add to that. But even in the context of a patient who's unaffected, meaning they have not been diagnosed but yet are found to have a higher predisposition than they may have otherwise, you know, perceived, I always tell them the primary endpoint with genetic testing with hereditary cancer is prevention and risk reduction. It's kind of like having this mutation does not mean that you will develop second or third cancers. It is not 100% guarantee you're going to ever develop a first cancer. However, we can use this information today to try to help circumvent as much of that risk as we can. You know, what can we do today to protect you from that risk? You know, if we knew that you had a 65% chance of dying in a car accident if you took this certain route, can we come up with a different route? You know, that, you know, may minimize that. So it's really just trying to help patients through the process, helping them to understand. And the other thing I tell patients is with genetics, if you come back positive, you do need that routine follow-up annually because, you know, even our understanding of these individual genetic mutations is changing. You know, there's new information as more and more people are testing. New cancer risks may be added to some of these, you know, genetic mutations. Some may actually be taken away. We've actually had some genes that where we thought there was a breast cancer risk, there may not be now. But again, just helping patients stay educated. And I find that the more informed a patient is, the easier it is for them to cope and kind of really take that information and use it to their advantage because it's really about empowering patients, you know, empowering them with the knowledge, the resources, the information. And I think formulating that plan of care is important because the patient is a part of that care plan. They're part of that team. It is not just me or their providers that are dictating. The patient is part of that. And knowing that they understand what should happen, how often, and knowing that information is being relayed to their providers as well, I think creates some security and comfort as well.
Absolutely. Well, Danielle, we are so thankful that you've joined us today. This has been such a wealth of information.
Thank you.
Just great. I learned so much today. Thank you so much for joining us today,
Yes,
for
thank
taking
you
the
all.
time. You know, it's Breast Cancer Awareness Month, and every October we remind you to please go and get your mammogram.
Yes.
Do your screenings. Stay up to date with your screenings. It is so very important to your health. Early detection saves lives.
Absolutely.
We are proud to announce here at HCA Florida North Florida Hospital that we have a new accreditation.
Yes.
It's the NAPBC accreditation. Do you know much about that?
Yes, so the NAPBC is a nationally accredited program for breast centers. This is nationally recognized. To be able to be accredited for this, you have to show exemplary, you know, compliance with standards of care. That means the clinical pathways that we use to manage and treat breast patients is not only the standard of care, but it even takes it a notch, you know, higher. There is a lot of accountability. There is a lot of surveillance and monitoring for programs that have this, and it takes a team. And we have a phenomenal breast care team here at North Florida. I will say that our oncology group, our surgeons, genetics, our VP of oncology, you know, ancillary, it takes a village. But I will tell you, I have seen the patients benefit immensely just from the breast care team that we have here.
Well, thank you for being a part of that team, and thank you for joining us today. Thank you all for joining us for another Facebook Live segment here at HCA Florida North Florida Hospital. We'll see you again soon. We have another one coming up here, I believe, so we'll stay tuned to our Facebook page, and we'll tell you a little bit more. And thank you for joining us for a special edition for Breast Cancer Awareness Month.